When you're kind of just a solo practice, you gotta be you gotta balance that out, your inventory and that kind of stuff. It's all doable. Don't let that stop you from doing it because you can. It's all doable.
So everything I've learned so far is flexibility is the key, and you have to be a little bit different to come up with creative ways where it's a win-win situation. Hello everyone, this is Azhar Hirani. Welcome to another episode of Practice Unlocked, where we dive deeper into inspiring journeys and wisdom of healthcare professionals. Today, I have a very special guest who is a nurse practitioner and who I've known for more than 10 years. I've done business with her. So I have a very special guest, Ms. Donna Jackson. Welcome.
Thank you. Thank you so much for having me.
Perfect. So, to start off, please tell us a little bit about yourself, your history, where you got started, what got you into being a nurse practitioner, things like that.
Okay. Well, I've been a nurse practitioner for over 25 years now.
Amazing.
And of course, as a nurse practitioner, you start out as an RN. So my background is acute care, ICU. So I started out, I went to school in San Antonio at UT Health Science Center there, and I worked coronary care unit. And I worked at Methodist Hospital. It was a great experience. I was so young back then, but learned so much. And I think looking back as a nurse practitioner, I'm so glad I had those times because number one, you're learning so much, but the other thing is you gain confidence. And you have to remember at that time I didn't know I wanted to be a nurse practitioner, but I think it just gives you so much confidence because you've got to give orders to other nurses. And if you haven't been there in some capacity in the hospital or in ICU, I think that, that could be a detriment. So I always think that is a big plus into being a successful nurse practitioner is having put your time in the hospital. I mean, there's no way around it. I just think that's a very valuable thing to do. So I did that and then moved back to Corpus Christi because I had to be by the beach. And my husband was a firefighter at the time. He wasn't my husband at the time. We were engaged. So he was a firefighter paramedic. And so I moved back to Corpus and worked on my master's degree. I really wanted to teach. I love teaching. And so I worked on my master's in nursing education back in Corpus Christi and did all that. And then I started teaching at the university for about 2 years. But I kept seeing the nurse practitioner students. And I was like, okay, now I think I want to do that. So I did postgraduate certification as a family nurse practitioner. And I really thought family was a good choice because it was pretty well-rounded. You could, if you weren't sure exactly where you wanted to go, you'd have that broad family practice. So you could go, it gives you a lot more options. So
makes sense.
So I opted to go into the nurse practitioner, and I'm so glad I did. It's been good, very good to me.
Amazing. So in terms of, I have a few questions about that.
Of course.
So I have a lot of friends that are nurses. I have a lot of friends that are nurse practitioners. I have a lot of friends that have done masters in nursing. So fun fact, my wife is also a nurse. So in terms of once you were a nurse, how long did you work at the hospital until you decided you wanted to do masters?
Well, what I did was I worked in like a med-surg floor for maybe about 6 months. And then I moved into ICU, more specialized. And then I loved all that, but then I really always knew I loved education. So I thought I wanted to be a nurse educator. And I was a nurse educator at our hospital in Corpus, Memorial Medical Center. It was kind of the county hospital. And so I worked ICU there for probably 2 years. So I was in the hospital for about 5 years.
Okay.
Yeah.
Until that time, you had already done your master's, or it took 5 years to start your master's?
I was completing it. So it probably, I pretty much stayed in school. I might have taken a few breaks while I had kids, but I got right back into it. So within that 5 years of being in the hospital, yes, I completed my master's, and that's when I moved into a position as a nurse educator. I was a critical care nurse educator in the hospital, and then continued on, and that's when I started deciding, okay, now I think I want to do nurse practitioner. And I think that's the beauty. One of the great benefits of nursing is that you have so many options. And so if you're just starting out, you may not know what you want to do. Oftentimes you don't. But because you get exposed to new things and new realms of nursing, you start finding new interests and you find what you're passionate about. And I think that's what happened to me.
Amazing. Do you think it's realistic for, folks that are wanting to make the transition into nurse practitioner or going into masters to stay at their workplace and then still pursue education? Because I'm sure that's really tough. Because I remember when my wife at that time we were dating, when she went through nursing school, I didn't see her for 2 years.
Right.
So I can't even imagine how it is while working as a nurse going into getting your master's. How did you balance that, or did you take a little bit longer? Do people have the luxury to do that? Because I know nursing is a set program. You have to do it between a certain amount of time. But is it the same for folks that are thinking to make that jump? Is it the same in master's as well, or you can kind of take your time?
Well, yeah, I mean, you can take your time for sure. But I think that's such a great question, because I think another great benefit to nursing is you make a good salary. And there's so many flexible opportunities either in the hospital or other jobs. But hospital, a lot of times you can do the 12-hour shifts, which are long, but maybe, you might do 2 12s a week. And because you're making pretty good money, depending on your situation, I mean, you're still having time for school. And a lot of times employers, hospitals in particular, I'm speaking to hospitals because that's my experience.
Absolutely.
But they promote you going back to school. And so they'll actually, say, yeah, they'll work with your schedule and things like that. And so, sometimes there's 2 12s on the weekend or even 3 12s. Some people do 3 12s in a row, but that gives you that chunk of time off to work on your studies in the week. That's how I did it. I did maybe 2 12s a week.
So add another element of kids. Did you have kids at this point, or?
Yes.
So that's tougher. So I know, but because you're at that, usually folks become, not everyone, but a lot of people in their early 20s, they're in school for being, a nurse. And then they're, probably starting to think about starting a family. And around the same time, they're starting to think, hey, higher education. So is that even a possibility, or they should, any suggestions on your end that should they wait to have kids until they're done with their higher education, or that's okay, that you could do both?
You can totally do both. But I mean, if you really want to focus and get it done, of course, having young children could be difficult. It just depends on the person. How driven are they and that kind of thing. I personally wanted to spend time with my kids. I didn't want to be tucked away studying and things like that. So I mean, by the time I was working on my nurse practitioner, I did have a baby. And but I had a great husband who worked 24 hours on, 48 off. So that was a blessing. Because he could take care of the baby and stuff like that. And so we were able to make that work really well because we just, we just figured it out that way. But for the most part, most of my schooling was done before I started having, because I have 3 children. So we did have our first, and we pulled it off. But I think it just depends on the person, how driven they are and how they can balance it all. Because that's another thing I think with nursing is that there's so many opportunities. You want to, figure out how to say no to some things or put it off sometimes, because you get a lot of great opportunities. And, I had to learn how to do that, say no to some things. So
now you've done your master's in nursing. At what point did you decide that you want to now be a nurse practitioner? What's the timeline looking like?
So I was pregnant with my second baby.
So each time you got pregnant, you wanted
I
higher
decided to
education.
go back to school, right? And I was pregnant. I had actual senior nursing students in the hospital. I was a clinical professor, and I was so pregnant. And they were like, "Please don't have this baby before the semester is over." But after I had my baby, then I took time off after I had the kids. I usually took about 3 months off, and then I did the postgraduate nurse practitioner, which was good because I already had my master's in nursing education, so a lot of that dovetailed in. So it wasn't a whole lot of classes, but it was the clinicals, and that's the part of being a nurse practitioner is you have to do a large number of clinical hours with either a physician or an experienced nurse practitioner or even a physician assistant. And so the clinical hours, there's no way around that. You have to, be there for that entire time. And so that could be a tricky one to navigate, but you got to get those clinical hours in. So
now, while you're in nurse practitioner school as well, were you also still earning at the same time? Were you still a professor, or were you still doing clinical hours in terms of work to get paid?
Mm-hmm. I took some time off. I took a little bit of time off. I think because I just had the baby, I just had James, and so I took off probably about 4 months, and then I went back and did like 12-hour shifts in ICU, 1 or 2 a week. While I was finishing up my certification in nurse practitioner. And it took me only a couple of semesters because I already had that master's in nursing education. So, but I was still able to earn. I think this is the thing, like I've worked ever since I was 15 years old. Wow. I love to work. Mm-hmm. And so, it was always, but I also like to have time to relax too. I think that balance is so important. And so, I was still, doing some work, and I think it also keeps your clinical skills fresh and everything. It just gives you more credibility. So trying not to take too much time off was not something I definitely didn't want to do that. So. No,
I love that. So in terms of, you mentioned opportunities that come your way. Can you describe certain opportunities that did come your way while being a nurse? Mm-hmm. And then when you transitioned into being master's in nursing? And then when you transition to be a nurse practitioner. And also the difference between a nurse practitioner and a family nurse practitioner, if there is any difference.
Okay, yes. So opportunities first. I think my first opportunity that I really was excited about and started really recognizing that, hey, this is a great opportunity, is when I was working ICU at our county hospital in Corpus Christi, and someone noticed me and recommended me as an educator, and recommended that I start doing the critical care educator role. And so it was like managers that I had worked for, and they recognized that, and they knew I was working on my higher education. And so that was a great opportunity. I learned so much being an educator. That's one thing I love about teaching, is you learn so much. Absolutely. So, I had that opportunity. And then, another thing that happened just from, again, building relationships, talking to people, networking, and also having that higher education, being master's prepared back then. Now everything's doctorate level. But master's preparation, is huge too. So an attorney actually got my name from one of my managers, and I got to serve as a expert witness in a number of cases. Wow. It was a huge learning experience. So I reviewed records and I wrote expert reports, and I even went to court and testified in court as an expert witness. And
this is during your nursing phase, or this is during master's in nursing?
This is after I completed my master's in nursing education. I was not yet a nurse practitioner, and I was still working at the hospital, and I was working in the education department. And at that point, I don't remember who, but someone, gave my name as somebody who could serve as an expert witness. And I was like, sure, I'll do it. I mean, my parents raised me like, go for it,
Wow.
do it. Yeah, you're going to be nervous, but go for it, risk it. So I started doing that. I started, reviewing medical records. That will teach you a lot,
Absolutely.
reviewing records
Yeah.
and writing reports. And I really did all defense work. And that's just what landed, in my lap.
So that's another avenue someone can make a decent income while being
Yes.
flexible, and you don't have to be on your feet. There's a lot of flexibility that comes, with
Right, exactly. Yes. I mean, I would review records late at night in bed because I'm a night owl. I worked night shift.
Wow.
I worked night shift in ICU all those years. And so I still to this day, like, I'd love to stay up all night. Not all night, but late. So yeah, that was really cool. Being able to have that experience and going to court and testifying as an expert witness, and we won. I mean, it was just like it was an amazing experience. And what did that do for me? Not only did it educate me, my confidence went up. When you do those kind of things and you risk it, your confidence builds, and then you start meeting more people and you start networking even more. So that's another great opportunity. And a lot of other ones. But I will say that one really big one is once I already have my nurse practitioner certification, and I've been working in my practice, I got to meet these awesome people from Houston, and they represented Altus Hospice. And I started, learning about hospice. I had always valued hospice, but as I got to know the people with Altus and learn more and be involved with hospice, I just loved it and learned a whole nother specialty area.
Yeah, I'm going to ask you a lot of questions about that too as well, in terms of how nurse practitioners can be involved with ancillaries or, just beyond their clinical role at the hospital to home health care agencies, hospices, and be involved in that in terms of on the administrative side as well, or work with different companies and how lucrative that can be for other nurse practitioners. But I do want to go back to in terms of being an expert witness. So I know that I have a client who is retired now from practicing medicine, but till today, he does write a lot of reports and is an expert witness. And he always tells me that it's an excellent way to earn money post-retirement. And it's not necessarily just for the money. It keeps you sharp. It keeps you, you're getting to learn so much more than you're, as being a witness, you're actually learning and doing the research behind a lot of things. It keeps your mind sharp. So I did not realize that as a nurse practitioner or master's in nursing, you could still continue being an expert witness. This is something new that I learned today. So this is fantastic.
Yeah, it's great. I mean, and like I said, it was defense work, and they were defending the hospital, and you got to look at all the nurses' notes and all the medical records. And these attorneys, as smart as they are, they don't understand a lot of that. And so, you got to realize you are the expert, because that's what you've done for years. So it's an amazing, it's lucrative, and it benefits you, like you say, keeps you sharp, makes you a better practitioner or a better nurse. And gives all kinds of confidence too.
Yeah, I can see that. Now in terms of in terms of getting into the hospice field, and I know that's how we met.
Right.
Altus Hospice is one of the companies that we used to run, which was sold now.
Yep.
But we used to run that, and that's how we got to know each other. And the reason I was very intrigued in what you do is because from all the medical directors that we've worked with, you were the only nurse practitioner. And that was fascinating for me. And from your experience, are there other nurse practitioners who get involved in certain areas like hospice, or you're one of the very few people that you know of as well, that you can, make, as a, would it be considered side income, or would that be considered a full-time income as well, or in addition to what you're actually doing, some additional income to doing some more work to what you already do?
Well, for me, it was additional. It was an investment. And your first question was, are nurse practitioners doing this? I don't think they are. I don't think they're doing it, and I think they should be. I think that maybe they're doing work for the hospice.
Mm-hmm.
Maybe they're doing assessments and things like that. That's great. That's extra money. Nothing wrong with that. That's awesome. But if you had the ability to become more of a partner, that's where you should be, because that's where, I can remember now I work with some great physicians. I work with some really good physicians where we have a great relationship. They value what I bring to the table.
Mm-hmm.
They're not looking to make money off of me.
Mm-hmm.
They're not looking to take a percentage from me. So I just feel like, we complement one another, and they see the benefit
Mm-hmm.
in growing their practice.
Mm-hmm.
And so I feel like nurse practitioners can serve as an instrumental role in like partnering with a hospice,
Mm-hmm.
because we're taking care of these patients and we have the relationship. We spend a lot of time with them.
Yeah.
And I've found it easy to talk to people about hospice. A lot of people don't find it easy, but I found it very easy to, because we already had the relationship and they already knew that we had done as much as we could do, and maybe the patient was responding to treatments. But the bottom line is we were able to work through that, and they chose to go on hospice, and it was good for them and it was good for the patient, and it was a great experience.
So break that down for us a little bit. So usually physicians get involved with agencies like a hospice, home health care, nursing homes, I'm assuming as well.
Mm-hmm.
But as a nurse practitioner, you were able to break through and become, a partner, in a business like this, but also as a medical director. As a nurse practitioner, do you have to be under a physician, under a physician's license? You could be under your own license. Just kind of break that down,
Yeah.
of how that really works, in terms of the legal aspect of it.
Of course.
And obviously everyone, this is a opinions podcast, so you should seek your own legal help. But from your experience, from what you know, from a clinical standpoint, please share that with us as well.
Of course. So I think it behooves you to know the legislation that surrounds your practice.
Mm-hmm.
That sounds like a given, but a lot of us just go and do our work.
Mm-hmm.
And so for me, when I first started I have my own practice. I am not employed by anyone. The Balanced Budget Act of 1997 was when Medicare started paying nurse practitioners directly with their own provider numbers.
Wow.
And so that was a pivotal time. And that was a perfect time for me to start using my relationships with the physicians to collaborate with them. So in Texas, you do not have to be employed by a physician. You do have to collaborate. You have to have a collaborative agreement with a physician. And that's how I work. I have a collaborative agreement with the different physicians that I work with.
Mm-hmm.
So the nurse practitioner is reimbursed at 85% of what a physician is reimbursed
Mm-hmm.
by Medicare.
Okay.
And so I was able to, start a practice, develop collaborative agreements with my physicians, with some key physicians that were supportive, and begin to follow patients and do my own billing. I have a medical management company that does my own billing, And I had 2 practitioners that were independent contractors that helped me. And so what we covered was, 7 or 8 different nursing facilities at once. And these skilled nursing units are inside the nursing homes. So back when I started doing it, no one was in nursing homes. They were sending everybody out to ER for every little thing.
It's a lot of wastage for the insurance company.
Huge.
So you're doing them a huge service.
Huge. So me and my nurse practitioners started going out to these collaborating with the medical directors of these nursing facilities to follow these patients. The physicians didn't have to pay us a salary. We did our own billing. They didn't have to pay any benefits towards us, but they got the benefit of having a nurse practitioner partner.
So I was going to say, how does that benefit them? Because they don't have to physically go themselves.
Right.
But then how do they get paid as well? Because they're missing out on that revenue as well.
Right. So, well, when you look at it, they don't have to pay our salary, which nurse practitioners
usually are employed.
Make a pretty good salary. Usually it should be more than 120, 130, something like that. So they don't have to pay our salary, number one. But a lot of the physicians that we collaborate with, they are medical directors of the nursing facilities. So they are getting paid to be the medical director.
Okay.
When you're the medical director, you're kind of expected to take patients and take a lot of patients and take, difficult patients, easy, whatever. You take patients. That's the whole reason you're the medical director, along with advising and things like that. When you partner with a nurse practitioner, you can easily take on a large number of patients because the nurse practitioner goes in there a couple of times a week, 2 or 3 times a week, and manages those patients. That makes your rounds easier, is the idea. When you come in, you can see more patients because things are in order. You're not coming in there having to get bogged down in patient care problems. Because if I had a problem with a patient, I've already talked to you as my collaborating physician. You already know what's going on. So it facilitates rounds. You can see more patients at once. You're getting paid by the nursing facility, so you're getting a medical director.
It's a stipend, right? It's like a flat fee usually. Okay.
Yeah. So, and your patients are getting well taken care of, and you're able to accept more patients. So that's how that all transpired for the last 25 years. Now, nurse practitioners are all over the place. Physicians are coming in. So I've really seen a huge change. Now doctors are coming into the nursing homes. They're coming in and seeing their patients in skilled. And so there's still room, for us to see these patients and stuff. It's just that they're getting a lot more visits now. So, yeah.
So, so now you've given me what the role can be, in a nursing home facility. Now, in terms of hospice, how can a nurse practitioner get paid? Are you replacing a physician's medical directorship, or usually there's a medical director that's a physician, and then there's also like a subcontract agreement with the nurse practitioner, or the hospice actually directly is contracting this nurse practitioner? Usually. Right.
So those are all options that can take place. A nurse practitioner can be an attending or a not sub medical director, like a co-medical director, because since we have our own license, you asked about our license. We work under our own license. We do not work under a physician license. We have our own license. We do have to have a collaborative agreement. So if we're serving in that role, we still need to be collaborating with a physician, which that's the Texas law. Other states have it where nurse practitioners can be independent. But in Texas, it is a collaborative agreement. So, it depends again on the hospice company too, because I feel like Altus, for example, was, you mentioned that was the first time that Altus had worked with a nurse practitioner, and I'm the only one that they had worked with. And I think what you saw is that I probably had some of the highest referrals.
Yeah, and you were very involved. I remember that.
And that's
very involved.
Yeah, because I believed in it.
Yeah,
So
passionately,
yes, and if it's something that a nurse practitioner believes in, whether it be hospice or some other, finding a way to be a leader in that,
a value add or a leader, makes sense.
Yeah, is super important.
Because you're the one actually seeing the patient consistently, so their needs, exactly what care they need, so you're able to easily relate to the company. I see a lot of value of having, if nurse practitioners do want to go that route, that's actually an excellent route. And it's a good partnership for any nursing home, hospice company, home health company to partner up with nurse practitioners. So I see that.
Yeah, it is.
Now, in terms of, you've used the word collaborative agreements. That's the first I've heard of it.
Okay.
So kind of dive deep into what is a collaborative agreement, just define that a little, for us. And also, what is it like, is it a shared model, or is it a flat stipend usually? How does that usually work out?
So it's a collaborative agreement is developed by the nurse practitioner and the physician. It's not a contract. It is an agreement that outlines what you're going to do. So, for example, mine is not more than 2 pages. It's very straightforward. It tells that you will see the patient, you will do patient visits, you will order medications, you will order lab, it will just outline what you will do. It also outlines like what resources you'll use. If there's a certain, like for me, it was the geriatric Merck manual for nursing homes. And then it states things like, you will maintain your license, you will maintain liability insurance. Nurse practitioners have to have their own liability insurance. And, it's just very clear, straightforward, like, what are we going to do? And it's also the physician delegating visits to the nurse practitioner. Like, you will be and prescriptive authority and that kind of thing. So it talks about all that.
Oh, wow. Okay. So having your own clinic, if it's run by a physician compared to a nurse practitioner, I know there's a revenue difference. So you do take a haircut 15%. In terms of the revenue you can earn, but is there any restrictions in terms of, like, a lot of physician practices, you go in, they're doing just more than just they're visiting the patient. They can do ancillaries. They can have blood labs in their practice, which they don't get any benefit in terms of revenue, but what they're getting is obviously their patients staying right there and getting the results right away. Right. They have ancillaries like some sort of infusion or some sort of clinical trials in their offices, or allergy treatments, things like that. Do those same benefits afforded to nurse practitioners as well in their practices? Yes.
Nurse practitioners can have ancillary services. There's always guidelines and requirements associated with things like that. Particularly if you're billing Medicare. Medicare is highly regulatory on various things that they require if you're going to offer things like that. And so, but yes, they can definitely offer different services like that. My primary practice has been nursing homes and skilled units. But in the last 8 years, I decided that I was interested in injectables. And I play tennis. I play tennis a lot. And I hurt my knee. And I realized, wow, I spend a lot of time playing tennis because I wasn't able to when I hurt my knee. And so I thought, what can I do? And I decided to take a course in injectables, which is like neurotoxins like Botox and Dysport, that kind of stuff, fillers. And I went and got trained for that. Wow. And got certified in it, and then started working for a few years doing that as a side gig. And now I've opened my own little sort of injectable, I'm not going to call it a med spa, but it's more of like an injectables. It's strictly injectable type things. And So there was nothing keeping me from that. I spoke with, when you have your own practice, you have to have articles and you have to be filed with the state. So I have all that in order. That's all stuff that has to happen if you have your own practice or your own business. And so I went through my accountant and my attorney that set up my articles and everything and made sure that all that was in order so that I could go and now do this, which is completely different from
very different
nursing
home,
ask right?
That. Yeah. But I'm looking at it. It's probably your passion now.
I love it.
And did you get hurt on your knee and you had to have like some sort of stem cells type situation, or?
It wasn't that. It was just that I had to be off my knee for a while. And so I discovered that, wow, I can't play tennis for 4 months. And I thought, well, now's a good time to go do this certification course. It kind of slowed me down. God knows what he's doing. He kind of slows you down. And then you think, well, what else can I do? And I was going to someone to get my Botox done. I was like, wait a minute, I can do that. So I got certified and now here I am doing it. And I have great clients and, it's very lucrative. I mean, I have really low overhead. It's just the product. The product is like gold, so it's expensive.
Yes.
But other than that, you have low overhead, and I'm like, I'm so thankful that I did this. So that's an example of like maybe not ancillary stuff, but another thing that you can do as a nurse practitioner. A big thing right now that is just amazing is this semaglutide. You've heard of the semaglutide?
I have not actually.
The brand name is Ozempic.
Oh yeah.
So
Ozempic I've heard of. It's all over.
Yeah, it's all
social media
over.
Right now.
Yes. Okay. Well, semaglutide is the
the generic name.
Yeah.
Okay.
Yes.
Gotcha.
And so
it's like naproxen in a leaf. So it's
exactly that type thing. So I have partnered with a pharmacy actually here in Houston, and it's a compounding pharmacy, and there's I've done all my research, and I have probably about 12 clients right now who I'm giving them semaglutide.
I was going to say administering or
Yep, I do a initial consultation with them. I order lab work because there's certain things. They sign a consent, an informed consent. We do a history. We do measurements and pictures and things like that. And then I see them monthly. I give them their medicine. I train them how to inject it. They have my cell phone. They can call me anytime with any questions whatsoever. These clients are losing weight and they're so happy and
Amazing.
They look so good. And it's a huge health benefit to them. There's a study out this week that just is raving about the cardiac, the improvement in cardiac status with patients taking this medication. So so that's just another opportunity. So
I love that. So and you still have your full-time practice.
Yes.
And you're able to do injectables and then start this. I'm assuming it is more on a recurring basis for these patients that, in terms of a flat fee per month, or because, I don't know any physicians who give out their cell phone numbers.
Right.
So is it more of like, I know certain functional medicine doctors do, but is it something similar in terms of having that relationship that, okay, you have currently 12 patients, you may have more, and they have access to you at any time in case whatever help they need in terms of medical or have any questions on how to inject this medicine or administer the medicine. Is that how it is? It's like a monthly type fee, or?
It is a monthly fee. Yes. And it's I want them to call me. I want them, no matter what. I'm used to taking call. I'm good with it. And most of the time they text anyway, so that's even better.
Yeah. Who calls nowadays?
I know. And
sorry for calling you too much for this podcast.
Yes, no, but I want them to. Now, let's say I get 20 patients and it grows. Well, I might need to have some hours or something. But I will tell you this, honestly, they don't call me that much. It's like I do a lot of counseling with them. We go over things. I tend to repeat myself a lot because people don't hear everything that you think they do when you're first telling about it. So I tend to repeat a lot. They're going to see me monthly anyway. But it works well, and they love having your cell phone. They feel good about that.
Yeah.
But you got to remember, this is people's cash money. This is not billing insurance, any of these injectables and things like that. This is cash. I just think people feel like it's part of the service. And I like it too. So.
No, I love that. So in terms of how do you keep track of these patients in terms, physicians use an EMR?
Mm-hmm.
Is there a special EMR a nurse practitioner uses? Is there special codes that pop up automatically knowing that you are a nurse practitioner?
It's not special codes. It's the same codes that physicians use, like when we do our billing.
Mm-hmm.
And yes, I use a electronic medical record for my patients in the nursing facilities.
Mm-hmm.
It's the same codes and things like that. But when my billers bill mine, it's billed under my NPI, or my provider ID number.
Mm-hmm.
And so they know I'm a nurse practitioner, and that's how they know how to reimburse me less. So, but it's all good.
Do you think that? Do you think one day it'll be at par, or do you think that's the norm? They want because I'm sure they want more physicians coming out as well,
right?
From the schooling, so there's probably a lot of lobbying around it. But
there's a lot, yeah.
But did it always start at 85% and stayed there, or okay?
It's Medicare is the one that does 85%. Other insurance companies do 80%.
Oh, they do lower.
Yes, they do a little bit lower. So, it's been like that for a long time, ever since I've been in practice. And you're right, the lobbying, or whoever's lobbying, Texas Medical Board, I suppose, they're strong. They're very strong. But nurse practitioners are too. So, maybe we'll work something out. I love collaborating with my physicians. I love having them there. It's all good, but there are states that you do not require that, and so
And in terms of for seeing the patient, there's a percentage of what a physician can get, but for the ancillaries, is it the same? Is it still 80 or 85%, or?
I don't believe so. That I don't know. I honestly don't know. I've not looked into that. So. I'm not sure. I would think that it's if we're talking ancillary, like lab and even if it was some sort of equipment you were selling, I would say that would more than likely be at a standard sort of par level. I don't think it would make a difference that a nurse practitioner was selling it or offering it. Am I understanding your question right?
Yes,
okay.
You are. Yeah.
Yeah.
So it should be at par. It's just that seeing the initial patient, would be at the level 80 or 85%.
Right. The actual visits by the nurse practitioner.
The visits.
Yeah.
But then in terms of, we obviously don't know the facts, but it should be the same.
Yeah.
But as long as you're allowed to offer it, so that's okay.
Right.
Very nice. So in terms of, do you think that, as a nurse practitioner, can someone make a full-time income? Like, I know there's a base salary or the norm, let's say, in a range, for nurse practitioners to work in either hospital setting, clinical setting. Do they make, because your business does provide a lot more flexibility for running your own practice, does it pay less or it pays more? And if it pays more, is there more work? Or if it pays less, is it less work? Can you kind of dive a little bit deeper into that?
I think a nurse practitioner with their own practice can make much more. I think that a nurse practitioner who is, depends, on their volume, like anything.
Right.
But the work is there. The work is out there. And the patient problems are there, and they need managing. And we all want to keep the patients out of the hospital. So in order to do that, you have to do patient visits. So there's plenty of work, and I think that nurse practitioners can make close to 200,000, 150, 200,000. I mean, it's out there. It's available. For me personally, I feel like I make plenty of money, but I don't work as much.
That's the difference.
I'm at that point right now
Right.
where I don't work Monday through Friday. I work, a couple of days. I take a lot of call. I do a lot of work at home, which is great. It's nice to be able to do your progress notes at home. So that while I'm working, it's okay because I'm at home and I have my puppy by me and stuff. So that's all good. But yeah, I think that's fair to say that a nurse practitioner can certainly make, and because there's so many opportunities, it's okay to do a few different things. You don't have to do that 9 to 5 Monday through Friday. There's other ways, and you should negotiate that.
I love that. So basically what you're telling me, if you have even some entrepreneurial spirit and you're looking for other avenues rather than a strict job where you're expected to show up at a certain time, leave at a certain time, take calls at a certain time for someone else, there is a way that as an entrepreneur you could kind of branch out. Now, and now give me if someone is interested in the aesthetics, injectables are huge right now. They're here to stay. So in terms of if you're not a nurse practitioner, do you can you open up a med spa, or you have to be a nurse practitioner or a physician, and can you make that a full-time income as well? Also, please tell us, how does it help your clients or your patients? Because I'm sure in a aesthetic spa, you call them clients and not necessarily patients, right? So how does it help the clients? And apart from just the aesthetics as well, medical needs as well, how can injectables help, these clients or patients in general?
Sure, absolutely. So first off, there are some nurses, RNs, that are able to do injectables. They need to have the physician on site, is the difference there. But they can be trained, and there's some very good ones out there. But
who are these? I didn't catch that.
The RNs.
RNs.
You asked if a non-nurse practitioner could do injectables, and yes, they can do some of what we call neuromodulators. Neuromodulators are things like Botox, Dysport, Juvo, Daxxify. Those are all brands, but they fall into a category of neuromodulators, which means they're stopping muscle movement that makes those recurrent facial expressions that cause wrinkles. So anyway, so yes, non-nurse practitioners can do that, but they do have to have pretty strict physician oversight. A nurse practitioner can do their own, can open up a spa or an injectable office. They do, in Texas, have to collaborate with a physician. So that's what I'm doing. I collaborate with a physician, and you have that collaborative agreement we spoke of. So I don't have to have the physician right there on site. A nurse practitioner can do this. They just have to be able to access them if they need them. So that's that. Some of the medical reasons, of course, we know these neuromodulators like Botox, it's to prevent or to treat wrinkles in the face, like where we make these recurrent facial expressions that cause wrinkles and that kind of thing. And so what we're doing is stopping that muscle movement, but still maintaining facial expressions, but softening the wrinkles and giving a softer look and not so mad look and that kind of thing. So that's great. It's easy, it's safe. It's something to do instead of surgery if you're looking to avoid surgery. So that's a cool thing to do. And once you've done that, you kind of that becomes your new norm. You're like, okay, I don't want to look the other way. So, but there are other sort of more clinical uses of these neuromodulators. And one is migraine treatment. It's very effective towards migraines. There's an injection pattern. I've done it many times for clients. There's an injection pattern that you do, and it goes through different areas of the head, even down into this muscle here. And the great thing about it, you do use a lot of units, but it tends to last longer because the effects last longer, because what's happening when we use it like in our muscles of our face is we're metabolizing it quicker because we're still trying to make those faces, believe it or not, and we burn through it and it wears off a little quicker. But up in the head, it lasts longer because you're not, using it. You're not trying to fight it, I guess, is one way to kind of think of it. Another great life-changing thing that I've done for a few clients with using these neuromodulators is for hyperhidrosis. And what that is excessive sweating. And there are people that is such a severe condition for them that socially they just have to like bring change of clothes to places. They have to wear certain garments or things like that to help with the sweatiness.
Yeah.
It's excessive sweating. So we take Botox and inject it into the axilla in strategic areas, and it cuts it. It doesn't eliminate it, but it cuts it dramatically. It's life-changing.
Oh, I can imagine. I have friends who I grew up around, and they would shake, they were very shy, first of all, to shake someone's hand. Right. And once they do, it was someone just basically washed their hands and never dried it off. That's how
Isn't that
sweaty it was.
Yeah.
And I remember playing sports with them. So, let's say if they give me their bat or something, it would slip away because it was so wet. And I know they would always carry handkerchiefs with them constantly. Yeah. So I didn't know that through these there are things out there that can slow that down.
Yes, yeah, very effective. Actually, it's really good. Oh, wow. Yeah.
And in terms of let's say you're not so as a nurse practitioner, you need a collaborative agreement, and then you could run the whole show. Can you do multiple clinics where you're not necessarily the one that's injecting, but you could hire others? Where can a nurse be under a nurse practitioner, or it can be like a nurse being under a nurse practitioner and the nurse practitioner having a collaborative agreement with the physician? Can they do that as well?
Yes.
Okay.
Yes. So a nurse can work under a nurse practitioner as far as injecting, and yes, and then the collaborative agreement is with the nurse practitioner and the physician, and he or she is the medical director of the entity. And that's kind of how I actually did my my nursing home practice and my skilled practice, because I had two nurse practitioners who were independent collaborators, and it's not that they worked under me, but they were part of my practice. And so what I did was I and I'm comfortable saying this, is I basically took a percentage of their collections because it was me who developed the whole practice and put it all together. And so, and it was still a really good deal for them because they had their own practice. Basically, it was their own business. So it was amazing for them too.
I mean, I know a little bit about the business just because my mom is a medical esthetician. Even though she doesn't do injectables, but she's looked into it in the past where she can have like a nurse practitioner or a nurse come in part-time for she would have block of patients or clients scheduled for one day, and someone else can come in and do those injectables. She hasn't gone that route, but doing the research around it, the biggest expense is the product itself. So when you're doing these revenue shares, do you guys do it where the product is that the norm where you take the cost of goods sold and then whatever's left over you guys split it, or is it all in the total revenue?
So maybe I wasn't clear, because these nurse practitioners that I had, this was for my nursing home. For my injectables, it's just me. So I don't have to share with anybody. It's just me.
Oh,
but
cool.
It's you're right. The product itself is pricey. And the only way you can get price breaks is to buy a lot of it. And when you're kind of just a solo practice, you gotta be you gotta balance that out, your inventory and that kind of stuff. So, but it's all doable. Don't let that stop you from doing it, because you can. It's all doable.
So everything I've learned so far is flexibility is the key, and you have to be a little bit different to come up with creative ways where it's a win-win situation, even at the nursing home where you're able to do a revenue share split model. This is amazing. Now, these are things you've done. Anything that we're missing that you do that you haven't shared that can be value to other nurse practitioners or even physicians looking to get nurse practitioners under them, or nurses who are thinking of being nurse practitioners, or nurses thinking of starting their own business similar to this?
I think I've covered pretty much everything I've done and am doing, but I think you've got to look at what's going on out there. Where's the need? I mean, it's just basic. IV fluids is another big one. Giving IV fluids to people, hydrating them. Just look around.
IV clinics are huge, right?
They are. And just start asking questions, start networking, start doing your research, and then just take that risk, because it's going to pay off. And just because you may run into some speed bumps, I mean, you've heard this so many times probably in life, but those are the best lessons, because you're like, okay, there's always a way. That's what I always told my kids. I'm like, there's always a way. There's always a way to do it. And so just not letting those little speed bumps kind of say, oh, well, forget it. I'll just go work for so-and-so. No, you can do it.
No, I love that. So where can someone go though? What's the resource? Is there a Wikipedia page for something like this, or what's the resource? Do you go to conferences? Is there trade shows for this that people can go and learn?
There's a lot of what I've done is talked with my doctors. My doctors have a lot of times connected me with good people like you guys, and I don't know.
She means just me.
Yeah. Of course, conferences, journal reading, just staying in it and keeping your eyes open on meeting new people and just trying to network. You got to get the kind of, what are you passionate about? That's huge, because that's what you're going to delve into. So I can't give you just like one, you got to go here to get all this. You, number one, got to see what excites you and figure out a way to make it a business.
No, I love that. So, my last question was going to be, please share some words of wisdom, but you just done that, literally. So, honestly, Donna, thank you so much. I've thoroughly enjoyed doing this podcast. I've learned a tremendous amount, and I know the audience has as well. So thank you so much for honestly, coming to our podcast. I know you just flew here 2 hours ago.
Yep.
So that is wonderful. So honestly, thank you so much.
Yes. Thank you. I enjoyed it.
So guys, I know I have learned a lot, and I know you guys have learned a lot as well from this podcast. I will see you guys on the next episode of Practice Unlocked. Thank you, everyone. Bye-bye. Thank you.
Thank you. Wow.
Thank you. Yes.
Good job.
Yes, thank you.